Hey everyone, I am back. It's Dr. Hammond here with your mental health moment. I hope that you have had a really good week. And for those of you who are new to Mental Health Moment, welcome. It's Dr. Hammond here. We are here live every Tuesday, 8 p.m. Eastern Standard Time on Black Women Empowered Incorporated Facebook page, YouTube, and LinkedIn Live. For those of you, and thanks for those who are starting to join here. For those of you who tune in every single week, welcome back. And for those of you who are watching the replay on YouTube, welcome, welcome. Be sure to subscribe. I will be doing Mental Health Moment every Tuesday, and you can always catch the replays if you're not able to make the lives. But thank you for those who are here live today. It's great to have you. And again, I hope you've been doing well, been practicing your self-care and working again on being the best version of who you are, which is what Mental Health Moment is all about. For those of you who are new to Mental Health Moment, though, every first Tuesday of the month is specifically devoted to children and teens' mental health. As you know, our youth are struggling. There's a lot that's been happening, especially good evening to you. Thanks for joining, especially after COVID and COVID pandemic and everything that has brought. So first Tuesday every month is specifically devoted to children and teen mental health. And again, thanks for those who are still starting to join here. It's Dr. Hammond here with your mental health moment. And I do want to give a quick announcement as people are joining here that on drnekeshiahammond.com, there will be, as I mentioned, information updated. I know some of you have asked information about upcoming speaking engagements. This week, actually, November 3rd and 4th, I will be doing virtual events. So no matter where you live in the world, if you want to join, go to drnekeshiahammond.com. I have all the information. But basically on November 3rd, I'll be speaking about autism and ADHD and how to help our youth that are affected by those conditions. And on November 4th, I will be speaking about youth who have different ability levels and who are transitioning onto after high school endeavors and how to help with transition planning and mental health. So if you're interested in either of those topics, again, you can go to drnekeshiahammond.com. You can get more information about those virtual speaking engagements. And again, I'll be uploading. We're not uploading, but our team will be putting more information on there because I know, yes, some of you have reached out and asked what city you're going to be in next. So definitely I'll make sure that the team has everything up to date for you so you have that information. But thanks for those who are still starting to join here. Good evening. Someone said, can you please tell me what is your YouTube channel? Yes, the YouTube channel is Dr. Nekeshia Hammond. So my full name that's there, Dr. Nekeshia Hammond is the YouTube channel, which again, will have the replays of Mental Health Moment if you all ever need to miss the live, and also has some other content on there related to some interviews that I did with different individuals giving their take on their mental health journey. But thanks for those who are still starting to join here. It's Dr. Hammond here with your Mental Health Moment. So again, I'm going to dive right in. Today, we're talking about youth mental health. And one of the questions that I commonly get as a psychologist is how do you know when a child really needs help? Because obviously children are at different developmental stages. They're dealing with different things. There's a lot that's happened in the world. So I want to share briefly with you today some of the warning signs, some of the things you can look for, whether you're a parent watching this, grandparent, you work with kids in some capacity, because what I've found is when we as a community are educated about the mental health and what does it look like for kids, we have an opportunity, right, to get them help early, which there's plenty of research that shows when interventions, when help gets there early for kids, they have a lot better outcomes as opposed to what normally happens when it takes years and years and years until a kid gets help. And then a lot of things have happened in their lives that did not need to happen and could have been prevented. So, and thanks for those who are still starting to join here. It's Dr. Hammond here with your Mental Health Moment. So one of the things to really be thinking about, and again, I'm not asking you all by any means to be psychologists or to be counselors for kids, but it's just something for you to think about any child that's in your life, or maybe a child, a friend of a family member, or neighbor or coworker whom that does have children, to really be thinking about, are we checking in with kids? Are we asking them, how are you doing? Are we knowing what their likes are, what their dislikes are? Are there sleeping habits that have been changing? Good evening. Thanks for joining here. Um, are there sleeping habits changing? Are there eating habit changes? Or is there just something that doesn't feel right? A lot of times we have to, as caregivers and as community members, to really trust sometimes our gut instinct. When you know a child is off, when you know they're not behaving like usual, all of a sudden now they're not wanting to play with friends, or not wanting to hang out, do certain things, or not wanting to play video games, which would be very bizarre, right? For a lot of kids, they're really into their video games. Uh, just starting to think about, okay, what might be happening with this child. And for some kids, it's interesting. And my work with kids over a lot of different years, mental health really looks different. So there's a lot of things. I mean, you can Google mental health symptoms for kids, right? However, it looks different depending on children. For some kids, they are making D's and F's. They're not doing well in school. And then I've met some kids that are making straight A's and they're still struggling too. So a lot of the things that sometimes we think like, oh, this kid's okay, they're doing fine in school, they must be okay, is not necessarily the issue, because a lot of kids are very smart and they will hide their mental health symptoms. But just something to keep in mind, to think about, okay, I'm noticing some changes. Even if they are doing amazing in school, they are struggling with their frustration, they're struggling socially, they're looking, they're agitated, they're irritated, or they're anxious, or all these different things that kids are struggling with. So the first thing, if you notice those types of things for an extended period of time, for you to really think about, I always say, first head to the pediatrician or head to the family physician, just to triple check that there's nothing physical going on with this child. There's so many things that could be happening with children physically that sometimes gets missed. So blood work to find out if there's any sort of physical health issues would be a good, an example. And then if there's nothing medically going on, and the family physician might say, you know what, this not due to any physical health issues, but instead it's really due to something mental health related. Maybe it's anxiety, maybe it's depression, maybe they're having issues adjusting, maybe they have ADHD, maybe it's, a combination of things, maybe they have a learning disability, right? So in that case, then we want to take the step to the mental health route. And thanks for asking. Someone said, good evening. How are you doing? Hope you're having a wonderful day. I absolutely am. Thank you so much for asking here. But the next step would really be to think about heading to a mental health professional, which I know that there's a huge stigma. I'm very aware there's a huge stigma with mental health, with treatment. Um, to that, I say, hopefully that we're moving forward as a society. I know we're not nearly where we need to be, especially in Black and Brown communities, when it comes to mental health, when it comes to treatment. So there's a lot of ways for treatment to happen, though. And I would always suggest to families to start with what the child needs and also your comfort level. So again, there's families that'll say, I don't want therapy, or I don't want medication, or I don't want this aspect of therapy, or I don't want to do family therapy, or whatever is the case. Then start with what you're comfortable with, because it's better to start something for this child rather than nothing at all. And unfortunately, over the years, I've seen a lot of kids, and good evening to you as well, thanks for joining here. I've seen a lot of kids that have unfortunately really struggled, a lot of heartache, a lot of pain, just a lot of things happening in school, whether it be suspensions, whether it be having to repeat grades, whether it be getting into trouble with peers or teachers. I mean, the list goes on and on, having trouble with family members. And it was because there wasn't something in place. There wasn't someone professionally intervening in that situation. So one of the questions that I get, and if you guys have any questions, be sure to put them in the chat, or you can also go to drnekeshiahammond.com. You can connect with me on social media. You can always reach out if you have any general mental health questions or you need any resources related to children's mental health. And I'll also be adding more and more resources to drnekeshiahammond.com. For those of you who are new, there are free digital toolkits on there to help with children's mental health, but I'll also be adding more and more resources, especially heading into this new year here. And good evening. Thanks for joining here. It's Dr. Hammond here with your mental health moment. So if there is a mental health issue for this child, I really want you to think about what is my comfort level and where can we start, right? Start with where you're comfortable with. And again, if it's one-on-one therapy for this child, if it's play therapy, if it's family therapy, if you want to go together with this child, if it's social skills therapy, if it's anger management, I mean, whatever it is that is happening with them, to really think about intervening. The other part of it, I do want to say, because I've seen, and I can speak to the US at least. I know you all are a global community, and thank you for joining again. But I would say in the US, there's this push right now, which I agree with, to make sure we're doing more screenings, mental health screenings with kids, which is great. But then when we find out, yes, this child may have depression or anxiety or whatever we find out from these screeners in the physician offices, then there's another wave of need that needs to be taken care of. I am very, very well aware there's, again, the stigma of mental health. There's barriers for treatment. There's issues with insurance. There's issues with funding. There's a lot of issues with the idea of only seeking therapy. If that is a route for you, would highly recommend it if that's what your medical team or your mental health professional has recommended to you. However, if that's for whatever reason is not applicable at this time, I would still strongly encourage you to think about, what can I do to enhance this child's life? How can I best support them? And good evening to you. Thanks for joining here. It's Dr. Hammond here with your mental health moment. Today we are talking, it's the first Tuesday of the month, so we're talking about ways to help kids and youth mental health today. So one of the things, again, if you're just tuning in, is thinking about going to a family physician of some sort if you start to notice some red flags with this child. Just to triple check there's no physical health issues going on. A lot of time that step gets skipped. And I have seen kids, they have low blood sugar that leads them to be irritable, or they have thyroid issues that's affecting their mood, or they have low iron or some type of deficiency in some way that affects them with their anxiety and depression and attention. It affects them in that way. So we really want to make sure that these kids are okay physically. And then the next step is to think about the mental health path. And again, there's a lot of different ways to meet the mental health needs of kids. So again, I'm talking today about therapy, for example, and different types of therapy. However, there is a lot of things that can be done in the home setting. There's a lot of things that schools can do. There's a lot of things that we can do as a community. A lot of times kids are struggling to feel understood. They're struggling to feel like someone cares about them. I can't tell you how many children I have met face to face, talking to them, again, not a textbook, but face to face, and talking to many youth over the years. I've had my practice now for 14 years, almost 14 years. So I've met a lot of families and a lot of kids, especially after COVID and all that brought, have really struggled with loss, have really struggled with anxiety, are still struggling with anxiety, frankly, about COVID and about all the things that happened over the last couple of years. So again, I urge you, even if you're listening to this, you're like, Dr. Hammond, I don't have kids, or maybe I have my grandkids, but they're not near me, or, in whatever capacity you serve, I always just want to remind you that as a community, we still have an opportunity to really make sure the kids around, whoever you're around, not just family members, but to make sure that they feel cared about, make sure they feel safe, make sure they feel connected in whatever way. Even if you can give a compliment, that goes a long way, because a lot of these kids, especially the teenagers, that they are stuck in their heads sometimes thinking about all these things that are not true about them. I can't tell you how many teenagers, especially that I have met, unfortunately, who just think really negatively about themselves. And a lot of it is not true. It's not true, but it might be something someone else said, or it might be something that they felt like because, whatever's happening on social media, they don't feel good enough. They don't, all these things they don't about their looks and who they are and all of these things are happening with our youth. So it's just critical right now for us to be thinking about as a community how we can really make these children and these teens feel safe, feel connected, feel loved, cared about. And again, I can list 300 things that you can do. But so if you need specific examples, let me know. There's plenty of organizations, whether it's your local school, in whatever way that you can help, it really does go a long way for our youth. So I want to remind you of that. Someone said, awesome practice, Dr. Hammond, missed you last week. Missed you too. And again, for those of you who are just tuning in, if you ever miss Mental Health Moment, you can always head over to the replay on YouTube, Dr. Nekeshia Hammond YouTube, and be sure to subscribe. You can click the notification so you can know when it's uploaded, and I will definitely, like I mentioned, be doing more content going into this next year here, and adding more resources on my website, drnekeshiahammond.com. If you all have any questions, if you have any comments, if you're like, man, I really want to learn about this specific area of mental health when it comes to youth, or not even just youth, but the other mental health moments that are not the first Tuesday of the month, that are more related to adults, be sure to, again, send me a message on Twitter, Instagram, LinkedIn, Facebook, any of those platforms. Just, like I said, just send me a quick message and I will definitely keep that in mind and bring that onto Mental Health Moment as well. But again, I hope that you all have an amazing week. I just want to share a couple of those tips today, especially because, like I said, there's a lot that our youth are dealing with. They just as how we as a society, there's a lot that we're still healing from and dealing with, frankly, from this pandemic. Even though we might not be wearing our masks, we might not be talking about vaccines every minute on the news, we still, as a community, some of us are still healing from some things that have happened over the last couple years. Some of the changes that have happened in our lives are more long lasting, right? And not just short temporary changes. So as much as we are still healing and we are still dealing with these things, so are the kids, so are the children, the teens. It was so disruptive for them. Just with the virtual education, some people didn't have internet, so they weren't even having a virtual education. There's a ridiculous amount of kids right now that are behind educationally, academically, emotionally, socially. It's really taken a toll. So again, as I wrap up here today, I really want to remind you to think about how can you just take a minute to make sure you're connecting with whomever it is around you, whether it's your own family member, friends, or in the community with our youth, because they really, really need our support. Good evening to you as well. Thanks for tuning in here. So I will be back next week, next Tuesday, 8 p.m. Eastern Standard Time, right here on Black Women Empowered Incorporated Facebook page, YouTube, and LinkedIn Live. So take care. Have an amazing week, you all, and I'll see you all next time. Bye, you all.